And let me update you on the situation in the US with COVID-19, because the number of people who have died there has now exceeded 150,000. Nearly 1,300 people died on Tuesday alone. That's the biggest daily total since May. And America's top infectious diseases expert, Anthony Fauci, has become a central figure in fighting COVID-19 in the US. We've heard from a great deal in the last few months. And he's been speaking to the BBC's Katty.
You've said before, Dr. Fauci, that you, during the course of your career, have spent decades preparing for this possibility of a pandemic like COVID-19. When you were preparing for something like this, did you ever imagine that the politics would make it difficult to effectively manage this kind of situation, that the politics would get so mixed up in this?
No, I did not, Katty. I think obviously when you're dealing with things that involve politicians, there's always a bit of political maneuvering. We've seen that in almost every outbreak, but it had been minor and didn't impact what we were doing with regard to response. But I think it's no secret from looking at the situation in the United States that there is a considerable degree of political divisiveness to a level that everyone admits. You don't need me to make that declaration. I think anyone, even with those who have more experience and more ability to observe and make judgment on that this is a very unusual situation of political divisiveness in this country.
Now, as we've seen plenty of times, President Trump doesn't always see things the same way as Dr. Fauci. This is what the president had to say at the White House briefing yesterday.
He's got a very good approval rating, and I like that. It's good, because remember, he's working for this administration. He's working with us, John. We could have gotten other people. We could have gotten somebody else. It didn't have to be Dr. Fauci. He's working with our administration, and for the most part, we've done pretty much what he and others, Dr. Birx and others who are terrific, recommended. And he's got this high approval rating, so why don't I have a high approval rating with respect, and the administration, with respect to the virus?
Well, that's another question. We'll leave that for another day. But let's go back to Dr. Fauci, who's had considerable pressure from the Trump administration, but as we've been seeing in these clips from Katty, is always giving very diplomatic answers. I've been asking Katty about that.
Look, I think he's been put in a very difficult position, and I was lucky I got half an hour of his time as he's handling this pandemic, and a lot of it we focused on the medical issues, things like masks, hydroxychloroquine, vaccines, that kind of thing. But it is worth asking him about the politics, because he's been put in the middle of this political situation, which is making it harder for him to do his job. I asked him about the president seeming to endorse, just as recently as yesterday, hydroxychloroquine. I asked him about the president retweeting somebody who had said that you don't need to wear masks. Dr. Fauci told me he thought that was not helpful. And then at the end of the interview, I asked him how he's doing. I mean, he's been going at this for 5 months, non-stop, 15, 16, 17-hour days, Roz. And he said it's stressful. And he said it's stressful because of all of these issues to do with politics. So he's trying to do his job, which is the medical side of things, and he's trying to manage the politics. And both of them, of course, very important, because he needs to be as effective as possible. What I heard during the course of my half hour with him was quite a lot of frustration, frankly, with people being lax about the rules, but also with this political situation he's dealing with.
And aside from the political drama, Katty, President Trump says, on the whole, his administration is following Dr. Fauci's guidance. I mean, is that fair? Do you think Dr. Fauci would categorize it in the same way?
Well, I think Dr. Fauci would make the distinction between the White House and the individual states. And what he told me is that several states have jumped the gun, that the medical experts at the White House, on the White House task force, came up with very clear guidelines on how America should reopen after lockdown, and several states, he said he wasn't going to name them, but several states ignored those guidelines and opened up too early, which is why we're in the position we're in. I mean, interestingly, I did ask him right at the beginning of the interview, you know, if we had been talking back in April and you had described to me the situation in America at the end of July, would it look like this? And he said, no, this is a lot worse than he thought it was going to be.
Well, President Trump's continued to promote this anti-malaria drug, hydroxychloroquine. That's despite the WHO and the US National Institutes of Health having found no evidence that this drug is useful for COVID-19 patients. It can also have serious side effects, if misused. This is what President Trump told reporters.
Many doctors think it's extremely good, and some people don't. Some people, I think it's become very political. I happen to believe in it. I would take it. As you know, I took it for a 14-day period, and I'm here, right? I'm here. I happen to think it works in the early stages. I think frontline medical people believe that too, many. And so we'll take a look at it.
President Trump's also defended his retweet of a video featuring a doctor backing the use of this drug. This same doctor in the past has talked about using DNA from aliens to make medicines, all of which led to this exchange for the ages.
The woman that you said was a great doctor in that video that you retweeted last night said that masks don't work and there is a cure for COVID-19, both of which health experts say is not true. She's also made videos saying that doctors make medicine using DNA from aliens and that they're trying to create a vaccine to make you immune from becoming religious.
Well, maybe it's the same, maybe it's not, but I can tell you this. She was on air along with many other doctors. They were big fans of hydroxychloroquine, and I thought she was very impressive in the sense that from where she came, I don't know which country she comes from, but she said that she's had tremendous success with hundreds of different patients. And I thought her voice was an important voice, but I know nothing about her.
Masks don't work.
Yeah, go ahead, Paul.
Last week you said
Go ahead.
masks. Last week, well, real quick. Last
Okay,
week you said
thank you very much,
masks-
everybody. Thank you.
And with that, the president was gone. Well, Katty Kay asked Dr Fauci for his take on all of that.
What about hydroxychloroquine? And I ask you about this because it's come back into the news because the president yesterday evening in the White House stood there and said that he believes in it and that it is safe, and again seemed to be touting this drug. Is the president right?
Again, Katty, it's not productive or helpful for me to be making judges on right or wrong. But what I can say is what I have said all along, that the overwhelming body of data from trials that were well run, randomized placebo-controlled trials, indicate that hydroxychloroquine is not effective in treating coronavirus disease or COVID-19.
And here's Katty again on whether President Trump's contributions to this COVID-19 debate have made Dr Fauci's job perhaps a little harder.
Yeah, we're in the DNA from aliens phase of this presidency, which is pretty weird, right? She's also suggested that that gynecological problems can come from having dreams about having sex with demons. I mean, it's bizarre, and clearly the president didn't particularly like it because he left the briefing room immediately as he was being asked about it. Look, I pushed Dr. Fauci on this a little bit, and clearly he's not very comfortable talking about the politics of this and about the differences he has with the president. But the reason that I wanted to push him on this is because Dr. Fauci has a 65% approval rating in this country. Very few people have that. There is so much misinformation about this disease out there on the internet. The president says one thing, some of the doctors say another thing. Here you have somebody who has a high degree of trust from the American public, and to some extent having his voice clarifying the issues around masks, the issues around hydroxychloroquine, I think is useful when the president might be saying something else. And I wanted to, to ask Dr. Fauci, look, in a sense, don't you have a duty to speak out because the American public does trust you at a time when they are getting a lot of misinformation and there is not a lot of trust in other institutions? So he doesn't necessarily want to talk about it, but he does want to make his position clear. His position is that masks are helpful. His position is that hydroxychloroquine for the treatment of COVID-19 is not helpful, has not been proven to be helpful. And he was very categorical that he has not misled the American public on either of those issues.